Good evening. You are tuning in to AWANI Tonight with me, Saraya Mia. Malaysia recorded steepest drop in press freedom index. And what is the reality faced by the urban poor more than 1 year into the pandemic? That's coming up. The country recorded 2,341 new COVID-19 cases today. This is the sixth consecutive day that the number of cases remained above the 2,000 mark. Sarawak recorded the most cases with 600 new infections. This is followed by Selangor with 539 cases, Kelantan with 429 cases, and Kuala Lumpur with 344. The first day of the national COVID-19 immunization program's second phase yesterday saw an 84% attendance rate. 528 out of 540 doses of vaccines were successfully given out. Coordinating Minister Khairi Jamaluddin said the remaining 16% was not administered because the supposed recipients were not present, adding that he would check into the matter. But the vaccines allocated to those who did not show up were also not wasted, as these were given out to volunteers present at the inoculation drive. At least 95% of the total 571,000 frontline workers have received the first dose of the vaccine under Phase 1 of the immunization program. Khairi said he expected the vaccination for all the frontliners to be completed by end of April. A few opposition leaders, including former Prime Minister Tun Dr. Mahathir Mohamad, submitted a petition seeking an end to the emergency so Parliament can resume. Mahathir said the state of emergency had did nothing to curb the spread of COVID-19. The former Prime Minister accused Tan Sri Muhyiddin Yassin of using the King's name as a shield against critics, making many Malays angry with the monarch instead. The King approved Muhyiddin's plan for an emergency in early January to curb the spread of COVID-19. The emergency involves no curfew or military powers, but Parliament is still suspended until August 1st. Muhyiddin's government remains in control and has extraordinary powers to introduce laws without parliamentary approval. Malaysia recorded the worst deterioration in the annual Reporters Without Borders Press Freedom Index. This is due to, in part, an anti-fake news law gazetted in March that makes the creation and publishing of fake news related to COVID-19 unlawful. Malaysia fell 18 places in the index to rank 119 out of 180 countries.
The World Press Freedom Index also found 73 countries totally blocked or seriously impeded journalism, while it was constrained in 59 others, adding that many governments had used the pandemic to worsen repression. Norway, Finland, Sweden, Denmark and Costa Rica were ranked highest in this year's ranking, while Eritrea, North Korea, Turkmenistan, China and Djibouti fared worst overall.
While leaders often pledge their support for press freedom, on-the-ground realities for journalists appear to be more grim. We speak to Muar MP Syed Saddiq Syed Abdul Rahman on defending journalistic values amidst shrinking freedoms.
As politicians, we should never claim to know the whole truth, right? Often the truth could at times be subjective, especially in a period in which there is media monopoly, state control over the Printing and Publications Act, which licenses specific news portals and at the same time can terminate those who are critical of them. I think in situations like this, the role of the media, journalists, are of utmost importance to ensure that there are sufficient checks and balances, to ensure that the state governments do not abuse.
In the annual press freedom ranking by Reporters Without Borders, Malaysia plunged 18 places, the steepest drop from last year among all 180 countries. According to the non-profit, this was because many journalists have had to censor themselves due to draconian legislations in place, including the new anti-fake news law enacted in March by the government.
I think the best way to deal with fake news is to counter those fake news with facts and figures. I believe the Malaysian public at large is matured enough to know right and wrong. And if there are fake news which are being circulated, counter it. Make sure that, and I'm very sure that even journalists and media will play a role in distributing the truth. Right, we've seen in many occasions where fake news have been circulated, then you see AWANI, Malaysia Kini all coming up to answer and rebut these allegations. So in a way, the way in which you deal with fake news is not to control what is being distributed, but is to counter it. And obviously, if it is slanderous or defamatory in nature, then there are legal recourse which could be taken.
The country begins its road to recovery as most economic sectors have reopened. While this may be good news, how are the urban poor dealing with the impacts of COVID-19 to the economy? What's the reality faced by this group more than 1 year into the pandemic? We speak to Wan Yan-shin from Ideas, who gives us an overview of the state of urban poverty in Malaysia today.
Although the economic sectors have opened up, we are still experiencing the impact of the pandemic towards the economy. So we have seen that GDP has contracted by 3.4% in quarter 4 of 2020. Unemployment rate has still very high. It hit the highest in May, the highest since 1990, which is 5.3%. Although it has gone down to 4.7% in July, but onwards after that it's still around the same number. And in January 2021, it's still at 4.9% unemployment rate. So many SMEs has closed down. We know the sectors that are affected such as airlines, tourism, hospitality are retrenching, and also they are closing down. So this has affected the jobs and livelihood of the urban poor, especially those in the informal sector. There are social support on wages and unemployment insurance for those in the formal sector, but for those who are in the informal sector, these are not widely available. So we still haven't yet to know what's the intensity and extent of the impact of the pandemic on the urban poor, but we could draw some conclusions from some of the surveys and studies done, and that have been done on pockets of the urban poor during the pandemic. And it will take some time for the economy to recover, and we need better social protection to support the urban poor during this recovery period.
For the urban poor, vulnerabilities faced by the group even before the pandemic was exacerbated due to COVID-19. Food security, digital divide, and mental health are some key issues that need to be addressed immediately, says Yan-shin.
We also have seen different kinds of vulnerabilities that emerged during this pandemic. One of the first few is actually food security during the initial times of the pandemic, where the urban poor has trouble accessing food during the MCO. So that is one of the vulnerabilities. Besides that, we do see an increasing in terms of the importance of digital. We see a great digital divide during this time. So in terms of urban poor, children have less access to online education, which has hindered their accessibility to education during this time. So besides the children, we can also see that the elderly is also vulnerable during this time because they are less likely to be technology savvy. So besides digital, we also can see that healthcare for the non-COVID patients have been affected throughout the pandemic, and we see a backlog in hospitals because of that. So some, for example, like cancer patients, pregnant women, and others have less of a care because of the stretch in terms of the healthcare system.
Yan-shin also underscored the vulnerabilities of those living in isolation and in crowded spaces and its impact to mental health.
During MCO, for those who have been isolated, who stay by themselves, and so we see that because of the uncertainty and the loss of livelihood, there is a lot of fear and anxiety among the people. And also, on the contrary to those who are staying at home by themselves, we see an overcrowding at certain, especially like low-income households, where a one-bedroom apartment can have like 5 to 7 people in that who are living in the same space. And during MCO, that is the only space that they do have access to. So these are some of the vulnerabilities that we see throughout the pandemic.
We'll take a short break. Stay with us.
Induknya adalah Melayu.
Balik kepada Islam. This is chain reaction polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita sudah tentu dia akan datang daripada pemimpin wanita.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
Welcome back. The Myanmar crisis will take center stage at the ASEAN summit in Jakarta this Saturday. The 10-member bloc is expected to discuss on how to guide Myanmar out of a turmoil since the February 1st military coup that overthrew civilian leader Aung San Suu Kyi. However, there have been divergent views among ASEAN members over how to respond to the army's use of lethal force against civilians. ASEAN's policies of consensus and non-interference in each other's affairs have also limited its ability to act. It was reported earlier that Junta leader General Min Aung Hlaing is expected to join, making it his first official overseas trip. Meanwhile, Prime Minister Prayut Chan-o-cha said he won't attend the summit. Thailand would be represented by Deputy Prime Minister and Foreign Minister Don Pramudwitnai. Japan has demanded for the swift release of a journalist who was detained in Myanmar during anti-coup demonstrations. Kitazume Yuki, who reported for Tokyo-based business daily The Nikkei, was detained on Sunday night and shifted to a prison in Yangon. He is investigated for allegedly spreading fake news. Chief Cabinet Secretary Katsunobu Kato, in a news conference, said it was unacceptable that Yuki was sent to prison before sentencing. A second wave of COVID-19 infections in the Philippines is taking a toll on the country's healthcare system. The now worst infected country in Southeast Asia reported an average of 10,000 daily cases since the beginning of April.
That is nearly double the levels in March this year. Intensive care units in Manila was at 84% capacity. Anger is rising at the government's handling of the crisis and President Rodrigo Duterte's absence from public view over the last 2 weeks. The government imposed restrictions in capital Manila and 4 nearby provinces from early April in an attempt to slow the outbreak. The Philippines reported almost 950,000 COVID-19 cases, with about 16,000 deaths since the pandemic started.
Meanwhile, Philippine President Rodrigo Duterte said he is prepared to deploy military ships to the South China Sea to assert the country's claim over oil deposits. This came amid growing domestic criticism for his reluctance to confront Beijing over its activities in Philippine-claimed waters. Tensions spiked last month after hundreds of Chinese vessels were detected at Whitsun Reef in the Spratly Islands, which are contested by several countries, including the Philippines and China. Beijing refused repeated demands by the Philippines to call back the ships, which they claim to be fishing boats. India reported its highest daily death toll since the pandemic began. 1,761 deaths were recorded overnight. This as the country battles a second wave that has left people fighting for hospital beds, oxygen, and medicines. India reported over 259,000 infections today, the world's highest daily rate. It has reported daily infections above the 200,000 mark for 6 days. Large parts of the country are under lockdown, including capital city New Delhi. Officials hope the lockdowns will help slow the virus transmission and relieve the pressure on the healthcare infrastructure. India has lost 180,530 people to the disease, still quite a distance from the over 567,000 deaths reported in the United States. But experts have warned that the official death toll does not reflect ground reality and that it could sharply rise as doctors struggle to cope with the pressure. Public health policymakers not only have to deal with daily rising COVID-19 cases, but also an evolving SARS-CoV-2 pathogen and supply bottlenecks from vaccine nationalism. Tonight on Consider This, we ask our panelists the best way forward. That is all we have for you on Awani tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro Awani app. I'm Saraya Mia. We'll see you again.